hypercalcemia are seen in which condition?
Hypercalcemia can be seen in hyperparathyroidism.
Yes.
Can be seen in multiple myeloma.
Okay.
We can see hypercalcemia due to vitamin D overuse.
Okay.
And we can see hypercalcemia if there will be metabolic process.
You can't see in that. You see these symptoms due to hypercalcemia. So, which of the respiratory disease is related to hypercalcemia? Any respiratory disease? Sarcoidosis associated with the hypercalcemia. And if a patient presents to you with a history of recurrent bone pain, also the polydipsia, polyuria, peptic ulcer, and upon investigation, the level of the parathyroid hormone is elevated, serum calcium level is elevated, and serum phosphate level is low. What will be your diagnosis? Okay, if a patient presents to you with a history of epigastric pain, also the polydipsia, polyuria, and this patient have the upon investigation the serum parathyroid hormone level is high, serum calcium level is also high, and serum phosphate level is low.
Primary hyperparathyroidism.
It is a primary understanding.
Primary. Phosphate is low.
Phosphate level is low.
Primary
Hyperparathyroidism. And if a patient presents to you with a history of pancorbital edema in the morning, and upon investigation the level of the blood urine nitrogen is very high, and the serum calcium level is low, and serum phosphate level is high, and also in this patient the serum parathyroid hormone is also high. What will be your diagnosis? Hyperparathyroidism. If a patient presents to you for a history of if a patient presents to you and he is a regular patient from the last 10 years, and know this patient is on a dialysis for the last 5 years, and upon investigation this patient level of the calcium is very high and parathyroid hormone is very high. What will be your diagnosis?
Magnesium, very low magnesium.
Very low magnesium. What will be your diagnosis? It will be tertiary hyperparathyroidism. Because in the tertiary hyperparathyroidism, there is autonomous production of the parathyroid hormone. That will say that it is a high level of the parathyroid hormone and also high level of the calcium. And if a patient presents to you with a history of epigastric pain, nausea, vomiting, and with the nausea and vomiting, the patient is suffering with altered state of consciousness, and the ketones are present in the urine, what will be diagnosed? Diabetic. The level of the potassium will be the higher low.
Total production is depleted, but it is hypercalemic.
Transient hypercalemic seen to the blood, but the overall potassium will be the low. So if a patient presents to you with a history of diabetes, and you are a doctor and you prescribe a medication, and after the 5 or 7 days, this patient presents to you with a history of sweating and also the confusion, sometimes of the palpitations, which medication you have prescribed to this patient? Beta blocker or liver?
And that's drugs which can reduce glucose level, can cause hypoglycemia, can be sulfonylureas.
Good. Sulfonylurea. So it is due to the sulfonylurea. And if a patient presents to you with a history of hypertension, hyperglycemia, and this patient HbA1c level is around about of the 9, and you prescribe a medication which causes retinitis and hypotension, what is the medication? Sodium glucose co-transporter inhibitor. Which one? Any and if a patient presents to you with a history of the diabetes mellitus and his weight is very high, what will be the medication you will prescribe to the patient? And if the weight is low and the diabetic patient, which best medication you will prescribe? And medication which causes to the heart failure. Zone. These drugs can to the hypervolemia, and at the end of the heart failure of this patient. And if the patient presents to us with a history of insulin deficiency, due to insulin deficiency, the serum osmolality will be the high or low?
Due to insulin deficiency,
yes,
serum osmolality will be high.
Why the serum osmolality will be the high?
Because glucose is in blood.
Because glucose is the hyperglycemia can lead to the hyperosmolality, and due to hyperosmolality, the thirst is a high or low? Okay, and due to thirst, the volume will be depleted in the form of the urine will be the high or low? And when the hypovolemia will be occur, then these affect on which part of the brain? About which part of the body? A brain. That it can lead to the. What is the mechanism of lactic acidosis in a patient of insulin deficiency? What is the mechanism of lactic acidosis in a patient of insulin deficiency?
Sir, insulin deficiency. Sir, whenever there is insulin deficiency, definitely there will be gluconeogenesis, lipolysis, which will make formation of ketones and breakdown of triglycerides. When there is formation of ketones and all that, then there will be the process that will cause formation of lactic acid.
Very good.